We started exploring the patient empowerment programme about 3 years ago. We started to think how we could take the next steps towards involving and engaging patients in their health experience. The overall vision for empowerment was very clear. It was to transform the patient's health experience with the facility of personal health records. Particularly what we wanted to do was ensure that our service users, our patients, are right at the heart of their health experience, connecting with not only South London and Maudsley NHS Foundation Trust, but with all the other relevant healthcare providers. By that, we're encouraging patients to find ways to be better informed about their health condition and the services available to them, and to more directly contribute to the care planning process.
Rather than the clinicians holding on to the records, it's about the service user having the records. It's about being able to see them, it's about being able to understand what's written about them, and also, more importantly, actually to write about themselves. It's about bringing their experience and sharing it with clinicians rather than vice versa. And I think that's going to fundamentally alter the relationship between clinicians and service users.
Patients in this more active, empowered role are likely to be more willing participants in research studies and clinical trials. That's a great benefit to the individual users, to our service and to the UK.
Our service has been involved in piloting myhealthlocker. This has involved running focus groups, inviting service users to comment on myhealthlocker and the layout and what they would like to see on there, what would be useful, what would be helpful, and the design. And then also a few of our service users have been what we call super users, like road testing the system and identifying any glitches or problems with it.
For the last few years I've been diagnosed as schizophrenic, so there's a lot of paranoid feelings which stops me from getting involved in things. Well, after a few years, the gap between seeing the care workers and consultants got longer and longer, and this is one of the things I liked about the Health Locker. Actually, if it existed then, I would have found out what changes were going on at the time. When I first heard of myhealthlocker, it looked very interesting. It seemed like it was going to be very useful because of instant access to it, because of the way there is an input from the professionals, and it seemed very easy to use. With myhealthlocker, I check my messages every day, so even if it's just something really simple that I do, it has a significant effect in terms of bringing me back in with other people from being isolated. My expectation is that it's going to have a major impact on the sense of isolation. Once there is a point of contact, it made a lot of difference.
When my GP saw Perry for the first time, we noticed that Perry was very forward in his mannerism from a baby. Their first diagnosis was autism. Then we found out he had ADHD, and then we found out he was high functioning. When I first went to see Dr. Rathwell, which is his consultant, we spoke to Perry at great length about what it was all about. He was responsible. The greatest benefit will be for him to be aware that he does have a disability, how his disability can affect him, knowing to look back on the days that he's recorded on how he's feeling as to where he is now.
It'll help me to remember stuff, because sometimes the next day I might not remember what I'm meant to do, or I might just get confused.
As he gets to use it and gain the access, he will become more aware of what his choices are as he gets older, and give him a greater confidence in supporting himself.
The Service user research enterprise based at the Institute of Psychiatry is conducting a big study collecting feedback from service users on the system and evaluating that. But it's very important to know what service users are thinking about the system and how they're finding it, and also practical aspects. Are they able to use it and make the most of it? Have they got any reservations, anything that might get in the way of them using it?
The feedback has been absolutely great. A real interest and more so excitement to participate in this process. Our service users want to be better informed. Our service users want to decide the journey that they take within our service. Our long-term vision is to set it in the context of an information ecosystem where the patient-owned record sits alongside other healthcare organisation clinical records and research systems, all working together to support better health experience.
In the future, I'd like to see myhealthlocker being used routinely by all service users in monitoring how they're doing and really shaping their kind of healthcare and their recovery.
The long-term goals of the Trust of this project are to fundamentally alter the way we relate to our service users, to fundamentally alter how we deliver healthcare. I would see this as just part of a long-term approach where we move to much more connections with people, with much greater continuity.
We at SLAM are very excited about the introduction of our empowerment model through personal health records. It represents a significant journey that we've gone through.
This is a way of genuinely transforming how people work in a way that everybody wins from. And it's the future. And I think clinicians at SLAM have a huge opportunity to be leading the way, both nationally and indeed internationally, in this regard. And it's also in tune with the government policy on information and informatics. So I think we find ourselves very much at the forefront, and I think this is an opportunity that would be crazy not to seize.